Well, welcome and happy July. I hope that everyone is having a great summer. We always want to make sure that we take the time to make new people to our organization feel welcome. So if you've got new folks working in your department, make sure they feel like a part of the team, like a part of the family. You know, every month I am able to speak to all of our new employees at New Employee Orientation. We typically have a room of 15 to 30 people, depending on the month. So that's a lot of new people to welcome into our organization, and we want to make sure that we do make them feel welcome every single day as they get started with us and helping us realize our mission of making communities healthier. We're really excited that we were able to recognize 2 DAISY Award winners this past quarter. The DAISY Award is a national recognition program for nurses, and it was established by a patient's family who, during a very difficult time, recognized the care and compassion that nurses demonstrate to patients and their families every single day throughout the country. And so they established this national recognition program. We have been fortunate to honor a number of DAISY Award winners over the years, and we had 2 more in the second quarter. At Harris, we had Tanya Bradley, an ICU nurse, and at Swain, as a part of our main med-surg unit, we were able to recognize Cassie Conley. So we want to congratulate Cassie and Tanya and thank them for demonstrating that care and compassion that sets apart, we believe, the nurses who work in our hospitals every single day. Thank you to them for taking great care of patients. And the DAISY Award is really recognition of work that goes beyond what we're expected to do. And they really have modeled that work and that behavior for us. So congratulations, Cassie and Tanya. We also want to congratulate Courtney Orr, who is a CNA in the Swain Emergency Department, for winning the Swain Award. Swain stands for Staff with an Incredible Nature, and Courtney has certainly demonstrated those attributes. And specifically, and I'm going to read this off, the Swain Award was designed to recognize those who make the most consistent impact on the patient experience by demonstrating visible initiative and action that exemplify commitment to our values, patient safety, quality care, and an excellent patient experience. So congratulations, Courtney, for being the role model for the Swain Award. We want to welcome John Songer, who is an orthopedic surgeon, just having joined Harris Orthopedics and Sports Medicine, joining our incredible orthopedic team of Dr. Supik, Dr. Hanley, Dr. Gates, Dr. Slechta, Alexis Wiley, and we're so proud of the work that our orthopedic team does to include the athletic trainers that we have around the region. But Dr. Songer is an important addition. You know, we lost Dr. McFerrin last winter in December, and we've been recruiting, and we were fortunate to come across Dr. Songer, who's done some locums work for us, and it's just turned out to be a perfect match, and we're so thrilled that he has joined our team on a full-time basis. We want to say thank you to Dr. Francis Mullet, who just retired from Harris Cardiology. Dr. Mullet was our first cardiologist as a part of Harris Cardiology. He came to us, I'm going to tell this story, I said it at his retirement party, I've said it many times, on the day that we learned that Asheville Cardiology Associates was going to close their office here in Silva as Dr. Haddock retired and Dr. Verde relocated. On that very day, that afternoon, we learned about that decision one morning in the spring of 2016, I think it was. That afternoon, Dr. Mullet walked into our hospital unsolicited and said that he was a cardiologist looking for a job. And what an amazing chain of events. And so we're so grateful that Dr. Mullet came here. He helped really stabilize our delivery of cardiology services, and he's been an important member of our team. So we wish him well and thank him for what he's done for the patients in our communities. This is the time of year that we update our strategic plan. So we're hard at work analyzing data, looking back on our strategic plan from the last year, seeing the things that we've accomplished, the things that we're currently working on, and then looking ahead to 2020 for those things that we will continue to do as we expand services to better serve the communities here in Western North Carolina. It's an exciting time. We've accomplished so many things in the past couple of years, from recruitment of physicians to offering new services like a new cardiology program and doing diagnostic caths, and expanding geographically. Later this year, we're going to open a rehab clinic over in Robbinsville. So we're really excited about the things that we've done, and we're equally excited about the things that are left to do. So thanks for all of your hard work during a time of rapid change, and we want to continue to grow and develop as we are the regional hub for healthcare here in Western North Carolina. Over the next few weeks, I'm going to be visiting individual departments, and I look forward to doing that. I've done a couple already, and we're going to talk specifically about the topic of culture. And we've been doing a lot of work around examining our organizational culture, examining what creates a great culture, where we have opportunities for improvement, and we've learned a lot in the past several months. One of the things we've learned is that culture is something that most organizations just don't actively manage. And a culture emerges, and there's nothing good or bad about a particular culture necessarily, but we can be much more intentional, we believe, in creating the type of culture that we want to have in our organization, that a culture that endures through changes in our industry, changes in people, changes in how we deliver services, changes in our region. And so I want to talk to each and every person in our organization about that and get your feedback and insight about how we go about building that sustainable culture that creates the enduring legacy that we all want to see after we're not here working at this organization anymore. So I'm excited about the work that we're doing and excited to talk with each of you about it in the next few weeks. So make sure you stay connected to us, Facebook, Instagram, Twitter, our intranet. Again, always say this, a lot of things going on in our organization. Things are changing for the better at a rapid rate. And we want to make sure you have the latest and greatest information. The best way to do it is to check in frequently at all of those social media sites and the intranet. It's such an honor to work alongside all of you as we seek to transform the way healthcare is delivered, to realize our full potential of being the hub for healthcare here in Western North Carolina. I'm excited about the work that we've done. I'm excited about the work that we are going to do, and I am appreciative of your commitment to treating every single patient and their family as if they were the person who you love the most. And that's kind of a theme as we build and intentionally manage this culture that I spoke of earlier. Every interaction with each other, with patients, with their families, as if it's the person who you love the most. So I'm proud of the work you do. I hope you continue to have a great summer, and we'll look forward to talking with everyone soon.